Hey everyone, welcome to our channel Clinical Knowledge and Medicine. Let's learn about fibroids. Definition: fibroids are generally benign neoplasm affecting 5 to 20% of women in reproductive age group. Etiology: each myoma is derived from smooth muscle cell rest either from vessel wall or uterine musculature. Although estrogen, growth hormone, and possibly human placental lactose have been implicated in growth of myomas, evidence for estrogen dependence. Myomas are rarely found before puberty and they generally cease to grow after menopause. New myomas rarely appear after menopause. Association of fibroids in women with hyperestrogenism is evidenced by endometrial hyperplasia, dysfunctional metropathic bleeding, and endometrial carcinoma. Myomas are known to increase in size during pregnancy and with oral contraceptives. Progesterone inhibits the growth of myomas. Large dose of progesterone orally for 14 to 21 days cause shrinkage of tumor. Secondary changes: degeneration, atrophy. As a result of diminished vascularity after menopause, there is shrinkage in the size of tumor. It becomes firmer and more fibrotic. Calcareous degeneration. In this, phosphate and carbonates of lime are deposited on the periphery along the course of vessels. Red degeneration. Myomas become tense and tender and cause severe abdominal pain with constitutional upset and fever. Tumor itself assumes peculiar purple-red color and fishy odor. Other complication of myomas: torsion. Subserous pedunculated myoma undergo rotation at site of its attachment to uterus. As a result, vein occluded and tumor become engorged with blood. Rarely it detached from uterus and called as wandering fibroid. Inversion of uterus. Capsular hemorrhage. One of the large vein on surface of myoma rupture causing hemorrhagic shock. Infection of some mucus and myomatous polyp may lead to blood-stained purulent discharge. Associated endometrial carcinoma. Symptoms: as many as 50% women are asymptomatic. Others are with single symptom or several complaints. Menstrual disorders, progressive menorrhagia, polymenorrhea, metrorrhagia are common. Infertility. Infertility is mainly due to associated PID, endometriosis, distortion of uterine cavity causing obstruction to sperm ascent, poor nidation, or coronary tubal block. Pain. Acute pain seen when fibroid is complicated with torsion, hemorrhage, and red degeneration. Women complain of heaviness in lower abdomen. Pressure symptom: urine retention, hydroureter, hydronephrosis, and rarely constipation seen. Abdominal lump, vaginal discharge. Physical signs: anemia may be noted. Abdominal lump may be felt with well-defined margin, firm consistency, and smooth surface. Bimanual examination reveal enlarged uterus, regular or post. Cervix moves with swelling which is not felt separate from uterus unless it is pedunculated. In cervical fibroid, the normal uterus is perched on top of tumor. In myomatous polyp, the cervical OS is open and its lower pole felt. The uterine fundus cannot be palpated if inversion is associated with fundal submucous fibroid polyp. Differential diagnosis: pregnancy, hematomata, adenomyosis, bicornuate uterus, endometriosis, ectopic pregnancy, chronic PID, benign and malignant ovarian tumor, pelvic kidney, endometrial cancer, myomatous polyp, chronic inversion of uterus. Investigations: HB blood group, ultrasound to check number, location, and size of fibroids, also useful in follow-up of fibroid after menopause. Hysterosplingography identifies submucous myoma and checks the potential of fallopian tube. Hysteroscopy, laparoscopy, useful in inversion of uterus while excising myomatous polyp. Radiography, CT scan and MRI. Intravenous pyelography in broad ligament fibroid. Treatment: medical treatment: iron therapy for anemia, Ru-486 or mifepristone 50 mg daily for 3 months cause amenorrhea and shrinkage of the tumor. Danazol 400 to 800 mg daily reduce size of tumor. GnRH analog can be used. Surgical treatment techniques used are myomectomy and hysterectomy. Myomectomy. It is indicated in an infertile woman or woman desirous of childbearing and wiring to retain uterus. Vaginal myomectomy, indicated in some mucous fibroid polyp. Hysteroscopic myomectomy, done in some mucous fibroid not removable by a simple vaginal route. Laparoscopic myomectomy, a pedunculated fibroid, subserous fibroid not exceeding 10 cm. Hysterectomy. It is indicated in women over 40, multiparous women, or associated with malignancy. Uncontrolled hemorrhage and unforeseen surgical difficulties may require it. Vaginal hysterectomy, laparoscopic hysterectomy. Thank you.